Hello everybody, Dr. Mankal here from Ottawa, Canada. I wanted to answer and talk about a common question that we get in the practice, and that is most people understand that chiropractic can help people with various pain syndromes, with back pain or neck pain, sciatica, headache stuff. But what they have questions about, which are great questions, is how can it help my kid with ADHD? And so I wanted to take a few minutes to explain sort of the science and the neurology behind that process. And so I have my trusted nervous system chart here. So many people understand that we have these five senses, right? The feeling, the visual, the auditory, the tasting, the smelling. All those are senses that go into the nervous system. But the sixth sense, the one that we don't talk too much, is this position awareness. The big word is called proprioception. And the highest density of these proprioceptors are located in the spinal joints, especially at the top of the neck and at the lower of the spine. So these position sensors, they are required to fire every second that we're alive to stimulate the prefrontal cortex. And so that's a nutrition requirement from the spine to the brain. But in some of the kids who go through, for example, either a traumatic birth process where their head gets pulled out of the womb, vacuum extraction, forceps, cesarean, all of those can be very traumatic to the neck area, and it can cause what we call a structural shift. And if you structurally shift the spine, it's going to alter the stimulation up into the brain. So my trusted brain lamp here I wanted to go over with you. So when there is great structural integrity and movement of the spine, the brain gets full stimulation. But what happens if there's a structural shift and it starts to deviate and we start to reduce that stimulation to the brain, and especially the frontal cortex, and then what happens is we don't seem to get the integration, the proper brain balance that goes on from that lack of stimulation of the spine to the brain. So some kids will present with, and they have a head tilt. Some of them have a forward head posture. And in babies, again, they will also tend to have it. They don't typically have behavioral problems, but they can be very irritable, they can be colicky, and it's a different presentation that way. But that's kind of how the process works. So if we can remove the obstruction or increase that stimulation from the spine to the brain, it seems like the brain integrates better. And so there has been hundreds of cases in pediatric chiropractic over the years, and one of those cases we actually published in The Art of Being Healthy for Kids, that we have one of our case studies in here. And so if you want one of these books, just let me know here at the office and we'll reserve you one of them, and you can let us know that by an email that you can send to us, or just contact the office. So that's how the process works. Proprioception, vital nutrient to the brain. Structural shifts, rob it. They don't get it. So that's why kids should be checked, because it can really help them integrate and allow them to really express their potential through the nervous system. Hope that explains things to you, and we'll see you in the next video.